trauma really?
Right.
That's the question here.
That's a really good question. I'm guessing you're seeing it everywhere and hearing it everywhere.
For a while there, yeah.
Mm-hmm.
Yeah. Not too much anymore, but...
Is it because you're not around it as much?
Probably.
Being at college. I've been, a little bit surprised at how everyday language the word trauma has become. And, well, really any of the psychological disorders.
I was going to say something, and it's just...
Go ahead. Go for it.
No, it's going to be like, he traumatized me. He's a narcissist. Because that is what you hear all day, every day.
All day, every day. And sometimes I'm
and it's like, you're not traumatized. And he's not a narcissist, but okay, cool.
Well, then if you start going, okay, so your last 5 exes have been narcissists.
Yeah.
Statistically speaking, right?
No, it's not quite possible.
It's unlikely.
Maybe you are
like
really attracting them.
Yes, like it's very possible. But I do think there is, at least I'm concerned. So like, it's great that people are talking more about mental health overall. But actually, I think what's happening is they're talking about mental illness because they're over pathologizing these terms.
They're self-diagnosing, basically.
Well, there's self-diagnosis. And, and this is this sort of slippery slope because I think it can be really helpful for people to be aware that this could potentially be an issue that they're dealing with. And so if that's true, then consulting, seeking professional help and getting an accurate diagnosis can certainly be very helpful. Mm-hmm. But I think a lot of times, at least what I'm seeing, and certainly this is the case with trauma, which is what our episode is about today, but just in general, what seems to be happening is people are taking a few symptoms and saying, oh, that's me. That's what I've got. That's what's wrong with me, right? Because essentially that's what this is that's what's wrong with me.
Everyone has symptoms of everything, though.
Right. That's what the whole aspect, when you think of the DSM and what these disorders, right? So we have to keep in mind, these disorders describe multiple clusters of symptomology that tend to explain what might be happening for someone for the purposes of treatment. Mm-hmm. And, so it's not just because we can all, we should all be recognizing ourselves in some of those symptoms. Many of those symptoms in there are very normal feelings or normal reactions, but it's when they are being experienced along with multiple other symptoms. And there's also other things such as duration and, there's a lot of, and impairment in functioning, right? So that's the other big thing that a lot of times people might miss, right? Which is, how is that impacting you in your day-to-day functioning, whether it's your relationships, your school or work, and what have you. And so those are important things to keep in mind when we're talking about overall diagnosis. But the word trauma is being used so generally.
Yeah. Everything is traumatic.
Do you buy into that? I mean, is that what you think?
No.
How do you make sense of it, though, when people are saying that around you? And we're talking not in the clinical setting. I'm guessing just sort of talking in general. So we're going to talk clinical, but then also just sort of everyday life that it's being used.
I don't know. If it's just one of my friends are traumatized, traumatic, I'm like, okay, period. Sure.
Sure, we're going to go with that.
That's what we're saying, but you and I both know that you're being a little dramatic with that. But sure. But your average individual, I'm just well, no, but okay.
So it's almost
but okay, whatever. Pop off, I guess.
Pop off. So it's almost like the words traumatic are being used synonymously or in conjunction with dramatic.
Yeah, probably.
So we got some trauma drama going on, maybe?
Not the trauma drama.
Surely not. And I know we're saying this and we're doing it in a way that's very conversational for you and I as we're talking about some of our experiences, but I want to make certain that people know by no means are we making light of people's experiences, whether they are traumatic or not. Some things are just hard. Sometimes life just really sucks.
And I think people get that confused with trauma sometimes.
Yes. Mm-hmm. You mean that sometimes life is hard?
Sometimes life's hard.
And bad things happen.
Bad things happen. And situations are just not great. That doesn't make them traumatic. That just makes them hard and impactful.
Yeah. And I think sometimes when you're going in, though, in these situations, like sometimes you just need like a big word that matches the feelings. And I wonder sometimes if that's the word that comes to mind is...
What other words could we use?
Well, distressing, upsetting, infuriating, heartbreaking.
I don't know that upsetting or infuriating like quite match the vibes of traumatic or traumatizing.
Well, what words would you say?
I don't know.
Like sad?
But like I get the appeal, you know?
Like you get why people are using it to describe it.
Yes, because that makes it sound so much bigger than just upsetting or
distressing. Heartbreaking.
That just makes it sound sad.
And yet, here's my concern with the overuse of the word.
I don't think we should overuse it. I'm not advocating for that at all, but I'm just saying I understand.
And I do get that. And yet what happens is because we're using it so frequently,
we're using it wrong.
In ways that it's not intended to be used or it doesn't match that, then what happens is it really dilutes or minimizes those experiences that really do meet that clinical definition of trauma.
Yeah.
Mm-hmm. Do you remember what the clinical definition of trauma was? You just had the class.
That was forever ago.
I think it was just last fall, but that's all right.
That was the first 8 weeks.
Yes. Okay.
That was back in August.
All right. So no one expects you to remember it verbatim.
I don't know. I know they describe it as big T's and little T's, and you don't quite agree with that.
Well, that's not the clinical definition. So that's
obviously.
why
I told you I don't know clinical off the top of my head.
So with trauma, when we're looking at it from the DSM or the Diagnostic and Statistical Manual by the APA, and that's gone through several different editions and revisions over the years. So the one that is most currently is, it talks about criterion A. So when we think in terms of the actual criterion A from the DSM, it's that a person has either experienced or been exposed to death either by actually experiencing it or witnessing it. And so there is this component of it being life-threatening. There can also be a serious injury or sexual encounter there. And with that serious injury and sexual encounter, that's usually because you fear for your life during that. So there is that element of feeling like you're going to die or you're witnessing somebody. And so going back, I think, to the big T and little t. So personally, I tend not to use that in my work because the big T's, by definition, that is what I'm usually considering as trauma because that is the clinical diagnostic language for that. Whereas in some of the literature, when they're talking about little t's, those are those like experiences that cause distress or pain, but they're not life-threatening. So by nature, they're not considered clinically traumatic. They don't meet the definition of criterion A. That doesn't mean they're not painful, hurtful, impactful. They're distressing. They can be life-changing too. They just
so do
were
you
not
think
life-threatening.
Maybe that our overgeneralized usage of the word trauma and traumatized comes from little t's?
It could be. I don't know. I think people are trying to make sense out of their experiences, and sometimes they want
and
words.
they're distressing and they're life altering.
Yes, and all of those things, but that doesn't mean they have to be a trauma. So I tend not to use the term little t's, because a breakup, especially for teenagers, it can feel like your life is ending, but it's not. And
but it's traumatic for them.
It's big for them. It's painful for them.
It's distressing.
I do not tend to use the word traumatic in that context. Unless, and there can be situations, right? So the breakup itself, I would not look at that typically as a trauma, but I want to know what led to the breakup, right? Because sometimes when we peel back the layers on some of these experiences, what we might find is, well, there was some physical violence within that relationship. Then I want to ask some more questions, right? Which is, when there was some physical violence, what was going on? How were you feeling? And sometimes it typically will emerge that they were very afraid, they feared for their life. So those moments of the physical violence prior to the breakup,
that was trauma.
That was trauma. But the breakup itself, right? So you've got to look at some of those things, right? The loss of a job, certainly impactful, can be scary as all get out, especially if you've got bills to pay and some of those other things. Our identity is impacted, right? So that in and of itself may not meet the definition. However, could there be some other things? Now, how are we going to provide food and basics? So it may not be a trauma yet. So all of these things could, as they compound each other, cause more and more major stressors within that individual and the family system and so forth.
I'm just thinking, you described little t's as distressing events, and that those all would be considered distressing events.
Yes.
Yes.
And I'm not minimizing them.
Traumas.
Right. But okay, so there's a lot of reasons why this matters, right? And I think a couple of things to mention, though, because I was sort of blown away by a couple of statistics. And one, they didn't surprise me, but they really made it more like, holy cow, I feel like this is problematic, and maybe opportunities also. So one of the statistics I was reading, and it's a recent one, which is that 40% of adults see at least one thing on social media a day about a trauma, right?
Probably.
And so multiple times a week.
Yeah, that doesn't surprise me.
That's a lot. Like, it's almost like there's no escaping it.
Is it? When you live in a world where that's what you see every day, is it a lot? Or is that just every day?
Well, I think you know me, I want to be careful about what we're consuming. So sure. But the other thing, okay, this is the one that I'm really concerned about, which is 57% of Gen Z learned about mental health issues from social media, not from education and not from like qualified providers. They're getting their information from social media.
What about qualified providers on social media? Think about that. Because you talk about growing your social media presence to get correct information out there. They would then learn about it through social media.
Well, that has been part of the impetus, because I'm like, y'all, there's a lot of misinformation on social media.
Yes.
And so what blew me away is when you look at the top 100 influencers on the topics of mental health on social media, what percentage of them are actually qualified professionals?
1%.
A little bit more than that.
3.
It's pretty low.
20.
I saw about, I didn't like do
15.
the actual numbers, but I would say about 20 to 25%, maybe. But most of them were individuals.
Just because they're qualified doesn't mean they're good at their jobs either.
That's true. And I also think, though, that, and again, I don't know that the right answer with this is just because somebody has had their own personal experience with mental health issues. And I am so thankful that celebrities and artists and athletes are coming forward and sharing their information, because I think that normalizes it. And I think it helps, especially adolescents, make sense out of what's happening to them and not feel so alone. So that is so important. I think where the potential harm comes from is when people become influencers in those categories, like it's become their identity. So they're speaking only about that mental health issue. Like that's who they are.
And then they're overexposed to it.
Well, and so that becomes them. But then where I see this being somewhat detrimental, and I think one of the things that I've been thinking about too, and I certainly do this as a mental health, I'm a little bit more gentler, I think, in what I say and how I say it, because a lot of things when I'm talking about depression, anxiety, PTSD, a lot of it depends, right? My client who is experiencing this versus my client who may have the same diagnosis but is experiencing that, they're experiencing these things very differently. Mm-hmm. And so sometimes it's really hard to speak to one thing with this authoritative, definitive, this is the way it is.
Because everybody's different.
Because everyone's different. Whereas if it was an individual speaking about their experience, mm-hmm. then they can speak about it more authoritatively. Because that's their experience. And that may resonate for some people, but it misses the mark for a lot of other people who are having those experiences. And so I don't know. These are just things I'm thinking about. I don't know that I don't certainly have any answers for anything. These are observations as I think about how can I help the people that I'm working with, find those connections, make sense out of their experiences and so forth. So the fact that Gen Z is learning about mental health primarily from social media.
Okay.
And primarily from people who are not, let's just say, probably likely not highly qualified.
They all probably sought out therapy at some point. Let's be honest here. Like, where else would you learn that word? Like, any of those words,
Okay, but can I tell you?
I have a question.
Yes.
Okay? Because if we weren't learning it from social media, would we know what trauma is? Would we know if we didn't see it on social media? Probably not. Because they're not teaching that in high school or middle school.
Well, actually.
Oh.
I don't know.
She almost lost it.
I almost lost it, y'all, when I had a young person, I think they were 10, who came to me. Oh, smart as a whip, like highly intelligent, such a neat kiddo. And knew exactly what he was diagnosed with. So he was borderline personality disorder. And I'm sitting here going, okay, we don't diagnose that this early, but I'm out of curiosity. I'm, like, okay, so what makes you think this? Mm-hmm. They did a worksheet in their class, and they had to identify, they were given these different examples of characters and what disorder they might have. And so he identified most with the character who was diagnosed with borderline personality disorder.
For reference, I started doing that like sophomore year of college in my psych major.
Yes. So inappropriate. Okay, first of all, you're not supposed to diagnose. I mean, like, you're not even eligible to diagnose, and you are finishing your second year in your graduate counseling program. Like, here's the thing. Even after you graduate, you're not eligible to diagnose a client.
Until I'm licensed.
Until you're fully licensed, which takes at least 2 years. So this is a bit concerning.
That's crazy.
I use it as an opportunity. And you know me, I'll just get out the DSM and I'm like, okay, so like, here's the thing. And which we finally got to later within a couple of sessions, a diagnosis that was more accurate. Definitely not borderline personality disorder.
She's not even old. They're not even old enough.
You know,
can't be diagnosed with
but
that.
how much of this is happening? I'm seeing it everywhere, you all, like the self-diagnosis. And again, I think that this is very interesting, right? Okay, because I've sort of had this.
Why is that in schools?
I don't
That's
know.
my thing. Because, like, I never learned anything like that.
I know. And then,
I mean, I learned it from you.
And I
heard about it, but.
Right. But I'm also like, we would need to go to, you know, I'm not going to diagnose you. These are the symptoms I am seeing. Even in my own kids, when I had like, nope, I talked with the professionals. I said, this is what I'm seeing, but I'm going to leave the diagnosis to them. Even within my own self, right? Like, as I've seen.
Even though you probably were correct.
Yes. And, you know, like, I don't know. When you have multiple people ask you in the same week if you have ADHD, and I'm like, you know, like, people can see that in me. I've never been diagnosed.
Granted, most women are never diagnosed.
We usually aren't diagnosed. And honestly, for me,
it's a whole nother topic.
It's a whole nother topic. And what I mean,
doesn't hold
I've
you
used
back.
to harness. I've harnessed it as a superpower. It works for me in certain ways, and treatment wise. At this point, it probably would be a moot point. Like, coffee does just fine for me. So I don't know. I don't need a label to help understand myself. I need a label if I need treatment.
Most people now do need labels.
Why?
I don't know, because I don't need a label.
No. Okay, but here's where I would say that it was important to me.
Okay.
And having my background and having situations that happen in life, right? Because life happens, which means bad things happen, potentially traumatic things.
Stop hitting that cord.
And so, so when these things happen, I can recognize it right away. And I'm like, okay, I know this is happening. I know what can potentially be the symptoms and outcomes. So these are the things I'm going to do to try to remediate any of that symptomology, right? So to me, that's what I try to recognize them as. So I'm just thinking, like, after the boy's birth, when they were born 13 weeks premature, I knew, you know, besides the physical health, but the attachment potential issues and all of that. So did all that I could to remediate that. After my car accident, I knew right away. I'm like, okay, I've had several days. This is what's happening, you know, not sleeping, the intrusive memories, this and this.
You use your knowledge as a protective factor to...
And I knew that if I did not do what I needed to do, right? Because I'm like, okay, this is acute stress disorder. I knew this. Right now, sleep is the most important thing, because if I'm not getting sleep, then the rest of this, right? Like the alterations in cognition and mood. So you've got the symptoms for trauma, right? The criterion A we talked about, experience. Well, my car accident definitely fit that criteria. So then we've got the intrusive memories. So flashbacks, nightmares, all of that. Then we had avoidance. Then we have alterations in cognitions and mood. So the crying or what have you. And then the hyperarousal. So I could see all of those things happening. And I knew that the first thing I needed to do was stabilize sleep. Right. And so I sought expert help, making certain I was not doing this in isolation, and was doing the work that I needed to do, because this is the other thing we know in mental health, right? And I want to go from a wellness perspective. So that's a thing that's very distinct for counselors too, is we have this illness model of what's wrong with us. But in counseling, we're looking at the wellness. Of course, we're going to have these types of reactions to this event, right? So, but I'm getting the help that I need and trying to remediate those symptoms as soon as possible, because what we do not want, especially when we're talking about trauma, there's this very specific onset of symptomology. This happened typically, and then we have these responses. There's some traumas that don't work that way, and we can talk about those, but typically there's a before and an after in what we would call an acute trauma. And so we want to remediate that long term. So we don't want the state to then become a trait. And so that's what we want to try to do, is remediate that as quickly as possible.
Yeah. Yeah. That was a lot of clinical.
That was a lot of clinical.
I was distracted by the giant fly flying around.
Oh. Yeah, it's going.
Yep.
Woo. So, I think another thing that's really important for people to understand is, of those individuals who do experience that criterion A, that life-threatening event, do you know what percentage?
Like 20%?
20%
of them experience trauma.
Well,
PTSD.
So the majority of people
turn out just fine.
They're not going to have those constellation of all those different symptomology, right? And that's just one cluster. Then we've got, duration, intensity, impairments in functioning. So there's multiple criteria that have to be met for a diagnosis.
And just because one person experiences PTSD from an event, someone else can experience the same event and not. Exactly.
And so there's this subjective aspect, right? This perspective of that event. But it also has to go, it ties into a lot of other things, right? What is the individual's trauma, their own trauma history? So did they have some other experiences in the past? What is some of their development? What do they have secure attachments? What is their coping style? What is their hope for the future? There's all these other things that go into play with those experiences of the traumas, right? And one thing that I have found, right, which is, and I do think when you talk about those major stressors that aren't quite trauma, like they don't meet the clinical diagnosis of trauma, where I see this being really troublesome for people is when they have an experience and they're trying to cope, the resiliency's kicking in, they're doing something, but then something else happens. And they're doing their best, and then something else happens. And so oftentimes what happens, and this is where a lot of times those major stressor events add up over and over. If we haven't had enough time, especially in between, to cope and sort of get our footing again before we get knocked with another one, that's when it can really be, we keep layering things, and it can be harder for the individual to get their bearing and to be able to sort of get back to that baseline. Yeah.
Why do you think people feel the need for labels now? I mentioned it earlier, but we didn't go there.
Yeah, I think people want to understand themselves. That could be one reason. They are seeking self-awareness. And so part of that is understanding what's happened to them, making sense out of that. I think the other way, and this is where I find it sometimes not so helpful, is when they're looking for maybe a label to make excuses for themselves, right? These things have happened, so I am the way I am. And there may be an element of truth to that, but then my question is, well, who do you want to be, right? So yes, these bad things have happened to you. What do you want for yourself? But I've seen, there's a saying, especially in the trauma world, right? Like a lot of times, when trauma happens, nobody asks for it, right? It's not their fault. This is something that happened to them. And then they have to try to figure out who they are after that. And that's part of the healing process, which is, and it's actually part of the process, what we call post-traumatic growth, is making sense out of their experience, right? So there's multiple steps in the healing process. And usually when you're dealing with trauma, there's one of two ways to address the trauma. One is by processing that traumatic event, and that there's lots of different interventions out there that can help, such as narrative work, exposure work. EMDR is one of the most effective, CPT. So there's different ways that you can process that event. That's one way. The other second way, and this is how I tend to do a lot of, especially since I work with a lot of clients with complex trauma, then typically that way is I'm trying to help them understand how their past experiences are impacting their present, right? So I mentioned before, right, there's sometimes these traumas that happen. There's a clear before and after, those acute traumas. The area that I tend to do a lot of work in is in complex trauma or complex PTSD, which is typically when children, especially between the ages of 0 to 6, have experienced abuse or neglect, typically at the hands of a caregiver. So somebody who was supposed to be taking care of them didn't or couldn't. So something was happening. And what we see is a very particular constellation of symptoms that impact development and have this sort of lifelong adverse impact. So that would be a little bit with the difference in that. I know I feel like I just said a whole lot of things. What are you thinking?
Not a whole lot. So with these labels, they're not always labeling themselves correctly.
That's correct, right? Because like I said, if they're calling it trauma, but yet clinically it doesn't meet the threshold for trauma, then this can have implications for several things, right? First of all, if it's not a trauma, but it's a stressor, then really it can impede resilience, right? Things happen in life. They're not always good, whether it's a breakup, whether it's not getting the job that you wanted or getting fired or what have you, then these are some major stressors that we can be using coping skills, use our social supports that actually help strengthen our levels of resiliency. But instead, if we want to call those traumas and we're labeling it as such, instead of leaning into social supports and in our coping skills, and instead, if we're putting this big label to it that really just sort of, sometimes what I'm seeing is like, oh, this happened and there's nothing I can do. And they sort of just feel out of control versus some of these things are, yes, they're big, they're painful. And yet a lot of times we emerge from all of those experiences as having learned something. Now I know when I'm in a relationship, this is what I absolutely want and this is what I absolutely don't want. And so when we go into our next relationship, we carry some of that information with us. Same thing, jobs. I like this, I don't like that. So a lot of times these big things that get interrupted or that we don't make the team or what have you, then we are doing something with that information where we can learn and grow in a way that's very different than if I'm going to be treating trauma. Mm-hmm. And so there's some missed opportunities for leaning into resilience and coping skills and social supports for that and using it as a learning opportunity, right? Which is very different than what I'm going to be doing if I'm treating trauma. Mm-hmm. So I think you have that. I also think, words matter.
Words matter, guys. I think that can be taken in so many different directions across any topic possible.
They do. Okay, but you
words
also know.
Words matter in general.
And
always.
Semantics. They do. Word choice.
I love a good semantic, guys. I think we all know this.
I think you're making fun of me, but that's okay. I'm going to lean into it and go with it.
She likes to say that I'm playing with semantics.
So I was an English major, true fact,
yes.
Secondary certificate in English. So, I think vocabulary is important and the words we choose. I mean, come on, even Freud would say your word choice matters.
Yeah, it does.
Yes. Okay, so what would Freud say about the overuse of the word trauma now, do you think?
Girl, I don't know. I'm not Freud. I don't know. What do you think he'd say? Yeah, it's a lot of thinking.
It's a lot. I would wonder if he would say something I mean, we don't have videos of him doing work. We have his written letters. But when I think of the gurus that we've learned from, I would wonder if it would be something like, so there's something about this situation that felt way too much for you.
Okay. That sounds like something you would say.
I was trained a lot with some of that. Well, or maybe I'm just projecting. Maybe I'm making the things up. That is what I would say.
Yeah.
Like, there was something about this experience.
Sounds like there's something really tough about this for you.
Yes.
Yes, I've heard it before.
And this is the other thing.
I've heard it. As your child, I have heard it. I'm sure your clients have heard it.
And that does not mean I'm not compassionate or empathic, because it is true. Like, there's something so big about this. Right?
What is it?
Or there's something that's so devastating, like, or this was life-changing for you. Mm-hmm. Right? And, and then part of the work will be too at an appropriate time, right? So maybe not in those moments, but I might go loop back to, I heard you mention this call to trauma. What does the word trauma mean to you? And most of them are like, yeah, I know. It's not really a
Once
trauma.
Again, like I said in the beginning, sometimes the word needs to fit how the situation felt. And saying distressing sounds like you're minimizing it. Because in the moment, it felt much bigger. And I
can get that. And yet I also know that PTSD has not been in the DSM forever.
Mm-hmm.
And so it took multiple attempts to get PTSD. And it originated to identify,
veterans.
The combat veterans, these individuals who have seen war, and they would come back, and it was called like shell shock, battle syndrome, all of these other words. And it took a lot of work to get this into the DSM.
I've read the books. I know.
You know this. And so sometimes I would say, never in the moment when I'm hearing it do I feel like it's trivial. I don't, because there's usually big emotions happening.
Yes.
And yet I really do wish people would use
other words.
I
wonder if it bothers you so much more than it does me, because I grew up with it just being thrown around, like on social media and stuff. Like, I'm in the age where they just throw it around.
It could be.
So for me, it's just like,
it's just another word.
Yes.
Right.
And for you, it's like, no, that's a diagnosis. And I'm like, no, it's a diagnosis, but it's also just a word.
Okay, PTSD is the diagnosis. The trauma is the event.
Yes. Okay. Jesus. So they're saying they're traumatized. They're not diagnosed with anything. Therefore, why does it matter? Why can't they just say it?
Obviously they can. They don't need my permission. They don't have to meet
a criteria for it if it's not a diagnosis. If trauma itself is not something diagnosable, then therefore...
I think the reason why I say this and why it is important to me, like especially in the words abuse, when people are using them in ways that are not describing actual events, then it minimizes individuals, and we're desensitizing people to those words when they're very dangerous. And people who are in those situations, do people hear them as much because of the watered down versions of words we're using?
Well, everything's watered down. Everything. There's different kinds of abuse. There's different severities. It's all watered down. It's all muddied.
Okay.
And therefore, there's different kinds of traumas. There's different severity of traumas.
There is.
Yes.
And then there's things that are just, these are events in life, and those do not meet the criteria of trauma at all.
There's no criteria to trauma because trauma is not a diagnosis. We just had this conversation.
Okay, but in order for a trauma to be considered to meet criterion A, then it would be the, feeling like your life is in danger or the life of someone else.
Okay. I'm just arguing with
I know you are. I know you are.
I'm just saying it to say it at this point. I had somewhere else to go with that.
You did?
Yes.
Well, okay, so another thing with this, it
wasn't done, but okay.
Oh, go ahead.
No, I don't have it right now, but just so you know, I might jump back into
You might jump back in. You just jump in right away. So there's a concept that was coined, and I want to say it's a Professor Haslam out of University of Melbourne who coined this term concept creep, right? Which is...
No, go for it. I remember hearing you when we were talking about this before. I heard you say his name, but I did not hear concept creep. And I'm like, oh.
Well, it's this expansion of these sort of harm-related terminologies that include trauma, other words, abuse, bullying, addiction, those types of things.
I remember what I was going to say.
Okay.
You said... words. You were like, well, it's not trauma. I don't remember what you said anymore because you cut me off and you moved on. Anyways, I don't remember what you said, but my argument for it was trauma's individualized. People experience traumas in different ways. Therefore, how can you say someone's trauma was not a trauma? If they're saying it's a trauma and people experience traumas in different ways, how are you going to say it's not trauma?
So perception is important.
Yes.
Mm-hmm.
Mm-hmm. Anyways, we can move on now.
No, I mean, but then we can argue almost any of those things. So, but by definition, it doesn't meet the category of being a trauma. Is it a life event?
I don't get how we can categorize a trauma and have it be a criteria if there is no diagnosis for a trauma. Yeah. This whole idea that a trauma is this, but how do we know a trauma is that? If things have evolved so significantly over the time of mental health, how do we know that in this day and age, the definition of trauma itself has not evolved?
It has, actually, and that's usually because of the diagnosis. So, for instance, what they found was this...
The only diagnosis is PTSD.
And acute stress disorder.
Stress disorder.
Yes. So, but the diagnosis itself has changed. So before, it used to have a subjective aspect to it, which is that the person had these feelings of helplessness or horror involved. Mm-hmm. And they actually found that had no... relevancy or impact to the overall diagnosis. So that was removed. So they do look at these things. They do clinical field trials and so forth to stay abreast of these things. We've been working for at least over a decade trying to get a specific diagnosis for developmental trauma disorder, or what is known as complex trauma or complex PTSD, because we see that it has its own constellation of symptomology. And with that, it has its own implications for treatment. Not all treatment for trauma, it works for dealing with complex PTSD or developmental trauma disorder. And the clinical field trials were concluded, and those are looking very promising. So we'll see if that ends up in the next DSM edition. So it does evolve based on what we know. It does evolve.
Maybe y'all aren't looking in the right places for the actual current up-to-date definition.
Right, we should all be looking at social media.
No, I think that social media has a major impact, and that could impact the way trauma is.
So let me ask you this. Is it... Go ahead.
No, just keep cutting me off.
Sorry.
I just want to say someone left a mean comment saying that me cutting her off was rude, but it literally... anyways.
I think sometimes we get excited and we're talking with each other. I don't consider it like
I was interrupting. Anyways.
No.
Whatever.
We get excited. We're passionate. We're talking.
I moved on. No, I'm literally just talking to create conversation because half the stuff I don't even agree with, but
Well, I was going to ask you, what do you think is trauma then? What should be considered trauma? Or not?
I don't.
It's
subjective, I think.
Okay, but you said even when you're with your friend and they're talking like, girl, this isn't, but you're going with it.
Well, yeah, because sometimes we're just dramatic.
Right.
I don't think she would ever be like, oh yeah, I have trauma.
So it's used as a way to describe, like, it feels traumatic.
Sometimes. I don't know. I don't know. I don't know. There's no right words with you.
I think there's lots of right words.
I think you're so set that, like, trauma is trauma. It is nothing else. It is not a descriptive word. It is not what you have.
No, okay. And maybe that...
And maybe that's probably just me being a little dramatic on that.
No, I appreciate that because within the context and when a client are like their feelings are big, I'm not gonna like not go with them because of that. However, I think part of the healing with wherever they're at
is recognizing what it actually is,
what it is, and what it's not. Because I have actually had clients who have gone through significant trauma and they're not even recognizing it as such. And so part of that is that psychoeducation so that they can start understanding the overall impact to them. And so that's enlightening. So it's sort of both ways.
If they don't recognize it as a trauma, is it really a trauma to them? It's perception.
Well, and I'm not saying that it's...
I don't know where we're at in this conversation anymore. I don't know where we've been.
Well, I think because for me, dealing with a lot of complex trauma, for them, a lot of times they don't recognize it because that's just life to them. This was just a normal Tuesday growing up in their world. And so they're not seeing this as having been traumatic. And that might be evolving and changing with people now recognizing it a little bit more. And I have had more experiences of people coming in not recognizing situations as trauma. I don't think I've ever had people come in who like, this is a trauma. And I'm like, no, I don't agree with you. Like that's not typical at all. Because again, I'm going with their subjective experience and perspective of the situation.
Right, yeah.
So,
but Mike, you were talking, a regular Tuesday for them, so they don't see it as trauma. If it's not a regular Tuesday for that person, they might say that's trauma, and you might be like, well, it's not technically a trauma. You might be like, when you're like looking at the situation, you're like, not technically a trauma, but for them it is. So really, the definition of trauma, like. Is it more subjective than it is in the diagnosis?
I think it's so inherently complex that typically I'm helping my clients unpackage a little bit more, right? Because they'll talk about maybe their parents' divorce being like the event, right? Or things like that. And the more that I'm in there asking questions, it's less about that my parents are divorced and more about what was happening. The screaming and yelling, the laying in bed as you hear things, sort of slamming, doors and cabinets and stuff, and the fear that was happening. So that is then what we're talking about is what it must be like laying in bed when you're 8 years old, hearing all of this happening and being very afraid, right? But in their mind, it was the parents' divorce because as they grew up, there was this,
it was the things that led to the divorce.
Right. So there's usually some things that we're pulling back the layers. And I think that's because trauma is so complex and helping people understand like what was going on for them in that moment, or that period of time, how they experienced it. Siblings, how their sibling who is, because
siblings
usually
experience things completely different from one another.
And yet they're the most similar experiences that somebody can have, right? But if you're 2 years apart, 5 years apart, what you experienced growing up, especially with parenting, it can be very different.
And I'm going to stop being argumentative.
It's okay.
No.
Well, I mean, I think you're putting voice to some of the things that our listeners are going to be having.
I'm really shifting my perspective from clinical to let me be the most Gen Z person possible and argue this. Yes.
Well, and I guess that's my question to you then. Do you think others your age, if they were not in that moment, validating their friend, being the good friend that they are, because of course, if your friend is talking about this traumatic thing, like you've got to be there, be compassionate, validate their experiences. But outside of that context, if you think like, if I came, okay, was it really a trauma? Do you think that they would be able to distinguish between different events that were life-threatening versus not?
Here's the thing. My friends all were in the psych field. So yeah, my friends, I'm pretty sure if I said, girl, was that seriously a trauma? Or are you just being like, yeah, let me describe it as one? They'd be like, no, it's not actually a trauma, but like it was trauma, you know?
Right. Well, I think something that's really important is keeping in mind that precise language, it's not about ranking experiences or gatekeeping emotions. People have different experiences that are very real, that are painful, that hurt. And so I think that we need to validate that. And I think that understanding, right, when I hear the word trauma, there's a very distinct difference where I'm going.
When you hear the word, you go to the DSM.
Well, and I go to treatment, right? Because breakups, I'm thinking we might be dealing with an adjustment disorder, depression, anxiety. Those are very real reactions. Job losses, right? In those kinds of situations, that's where we're probably looking at those things. And those have very specific interventions for treatment that I'm going to be using. Whereas if there was a car accident or an incident of domestic violence or these other, sexual assault, all of those things, those are very different types of treatment. And so, yes, when I hear a word, I am going to be looking at what is the situation because the words matter, especially in regards to treatment and outcomes and those types of things so that I can best help my clients through that. But the pain is all very real.
The pain is real.
Yes.
We've run out of time. What's your takeaways?
My takeaways is, oh, goodness. I worry that I say some things that sound very strong with opinions. And I hope people can hear that all the feelings are very big and very real and very valid. And yet these are important. The distinctions between them are extremely important for professionals to know what the best way for treatment. That's my takeaways. What about you?
I feel like I should throw out there that I was being rather argumentative, and it was for the sake of the conversation to shift perspectives. But yeah, I don't think everything's a trauma. I do think we overgeneralized a lot of things. And yeah, I don't know. That's all I got.
Okay. Well, and I really want help normalizing a variety of different emotional language that people can use to capture these experiences.
Okay. Bye.
Bye.